Hello, and welcome to this National MS Education Awareness Month teleconference, hosted by MS Focus, the Multiple Sclerosis Foundation, and made possible with support from Biogen, Novartis Pharmaceuticals, EMD Serono, Genentech, and Sanofi Genzyme. I'm your host, Casey Minnis. I'm Director of Communications for MS Focus, and I'm pleased to be joined by Dr. Fred Foley, who will discuss the topic, Focusing on the Present and Adapting to the Future. Please note, in order to ask questions during the Q&A session that will follow this presentation, you will need to connect to the conference online. Go to readytalk.com and join with the access code 7766805. So again, that's readytalk.com and the access code is 7766805. I will give you that information one more time before we start the Q&A. Now, let me tell you about our speaker for this evening. Dr. Frederick Foley received his PhD from Fordham University in 1986. With extensive experience as a professor, researcher, and clinician, Dr. Foley is considered a leading expert on the subjects of cognitive change due to MS and sexuality and intimacy as it relates to MS. He's also well known for his research in sexual dysfunction and depression in multiple sclerosis. We're very pleased to have him with us to discuss this important topic. Dr. Foley, thank you for being with us, and I'll turn it over to you.
Well, thank you very much, Casey. And I am very delighted to be here, and I would like to thank the MS Foundation and the sponsors for this wonderful program you have on inviting a variety of speakers to have a conversation with the MS community out there. So I'm ready to take questions now, Casey. That was a joke. I'm supposed to give a little talk first, but I thought I would surprise you.
You had me there.
Right. And the reason I'm starting out with a little surprise, a little joke, is because one of the key things about adapting to the present or the future, which is the focus of the talk tonight, is to be able to keep a sense of humor. If you can keep a sense of humor, even kind of in the depths of difficult moments, and just find something ridiculous to laugh at that day, whether it's kind of our own behavior or our own kind of humanity or something about ourselves or about life in general, it just makes it a little bit easier. So, and also, humor is a great way of putting things in perspective. Now, I know that's easy to say, and when you're in the depths of struggling with something or angry about something or depressed about something, humor may seem like an intangible thing. But again, the depth of whatever you're dealing with that's negative is not going to last forever. And by appreciating a little bit of the humor in life, you might be able to shorten your time in the pit, so to speak. So, focusing on the present and adapting to the future. When Casey asked me to kind of focus on this presentation, I was wondering myself, well, what does this mean, focusing on the present and adapting to the future? And I guess the first thing that came to my mind after kind of saying, okay, let's play a joke on Casey, was the Marine Corps kind of motto of adapting to the future, which really is improvise, adapt, and overcome. I have some family members that were in the Marines, and they told me that is kind of a not an official Marine Corps motto, but one that is very common. And I was thinking about MS, and I was thinking about all the people I've worked with over the years who have taught me so much about MS over the last 38 or 40 years. And I would like to modify that Marine Corps motto a little bit for persons with MS and their loved ones and families. It's really not improvise, adapt, and overcome as a way of coping with MS, kind of embracing the future. It's really improvise, adapt, accept, and enjoy more than overcome. So MS, may be viewed as an enemy. but certainly improvisation is necessary. Creativity is necessary. Flexibility is necessary in order to enable us to adapt and eventually to put MS in its proper place in our lives so that we can have perspective. And I'm going to talk a little bit about that and how perspective changes and how at times it's not possible to put MS in its proper place because it may deserve an exclusive focus at different moments. For example, at the time when you're getting diagnosed with MS, well, it really requires a lot of focus at that time. Something is going wrong, with your body. Things are not working right. You're going through a process. You're going to physicians. You're going to trying to figure out what is wrong. And at the time of diagnosis, it really requires a tremendous amount of learning to take place. What is this MS? What does it mean for me? Does this explain my symptoms? What do we do about it? Are things going to get worse? Will things stabilize? So there are many, many questions and a great deal of learning. So there is a necessary, intense focus that needs to take place in order to kind of be able to have the knowledge one needs to improvise and adapt to the MS situation. But living with MS is not living in a state of constant crisis. So it's important to, after one kind of gets the knowledge one needs, to kind of help the healthcare team co-decide with you on appropriate courses of treatment and management of symptoms that are popping up. Then, you can be ready to, okay, let's put it in the background a little bit so I can focus on things in life that are important. Let me take care of myself. Let me kind of put together this healthcare team so that now I can focus on relationships. I can focus on the things in life that I want to enjoy. And maybe I can't enjoy all the things I used to. So MS presents a challenge that forces us, loved ones and forces persons with MS to reinvent themselves over time, to kind of embrace a new self in some ways and kind of adapt to that and flexibly kind of learn, how to cope with, how to accept, how to maximize enjoyment of life in the face of the symptoms that MS is presenting. This is a big challenge, and some days you're going to be much better at it than others. There are many things in the present that can pop up in MS that are necessary to focus on. For example, I had one person, that I was consulting with tell me, Dr. Foley, I just feel like sad all day long, and I don't enjoy the things that I normally would enjoy. And it's not just because I can't do them anymore because of my MS. I just have no motivation to enjoy things anymore. And I asked the person, well, what do you think about yourself and the world in the future? And she said, everything looks dark to me. Everything looks black. And so after talking to her a little bit longer, I realized that she had a clinical depression. Now, depression is fairly common in the general population, but clinical depression, which is a severe depression, something called major depression, happens much more frequently in MS. So in MS, if you find yourself kind of in a black mood, not enjoying things you would normally expect to enjoy, feeling sad, crying, kind of focusing on the negatives about yourself, the future, the world, well, you may have a clinical depression. And it's important to recognize that depression occurs much more frequently in MS. It occurs much more frequently, particularly in the early years of MS than in the later years of MS. So for whatever reasons, and there are mixed reasons for this, it could be activated by certain elements of the MS process in the central nervous system itself. It could be activated by the shock of going from a relatively good state of health to all of a sudden coping with the idea that one has an illness that I have to cope with from here on in that is not going to go away. So, all of these things and other things, changes that are unexpected can take place, can kind of precipitate a depression. So it's important to recognize when you have one. It's important because major depressions, severe depressions in MS are common, and they're associated with a number of negative outcomes. For example, when people are clinically depressed, they tend not to take care of themselves as much as they would. They take their disease-modifying therapies less often. And we know that it's very important to take your disease-modifying therapies on a regular basis with MS. It's kind of one of the things that doesn't seem obvious in MS. Well, if I skip days here and there, what difference does it make? We believe that in the long run it does make a difference. And taking it regularly will reduce your long-term susceptibility to exacerbations and disease worsening. So I think that anything that interferes in your ability to take that, like a clinical depression, is important to address. The other things about depression are you'll wind up moving less, exercising less, participating in relationships less. So all aspects of life become a bit gray and diminished. So I think now that I've kind of depressed you with the news on depression, I want to give you some good news about depression and MS. We know through our studies and through many of my colleagues' studies that depression and MS can be very successfully treated. But in order to successfully treat it, you have to recognize that you have it. And many people that are depressed will tell me, oh, I'm depressed, I didn't know that. Or I'm depressed, well, I have something to be depressed about. I have MS, or I've had these changes in my life. Kind of with the implication that there's nothing they can do about that. Well, you can't do anything necessarily about having MS, but you certainly can do something about having a clinical depression. And that is very, very important to treat. Your quality of life will go up significantly. Your relationships will improve. And importantly, you'll be able to enjoy something about life every day once again. So how do you treat depression, clinical depression and MS? There is a growing literature that shows that a type of psychotherapy called cognitive behavior psychotherapy is very effective at treating major depression and multiple sclerosis. There have been a number of randomized clinical trials, that have demonstrated this. So, and that seems to be more effective than other types of psychotherapy that it has been compared to. So I want you to keep that in mind, that if you get a clinical depression, talk to your physician, talk to your healthcare team right away, because your physician or healthcare team can prescribe antidepressants for you as well, which have also shown some effectiveness at treating depression and MS. And you can also ask your healthcare provider for a mental health clinician that's familiar with MS, that knows how to conduct cognitive behavioral psychotherapy for depression and MS. So as uncomfortable and painful as depression is, because really what it is a state of emotional pain that you experience, the good news is that it can be aggressively treated. The earlier you get it treated, the better. Now, what we found in studying people with MS over time is that depression tends to hit hardest during the first 10 years of MS or so. And after people have it for a while, that is MS, depression tends to get a little bit better on its own. That doesn't mean you should not have it treated, however. You should have it treated. Why does it tend to get a little bit better over time? Well, nobody really knows why. We think that maybe people adapt over time. People are resilient. People kind of are learning how to improvise, adapt, accept, and enjoy, and kind of learn to cope with MS sufficiently that their depression remits over time. We also think that there might be changes in the central nervous system that happen as people have MS for longer periods of time. There tends to be less inflammation in the central nervous system, and inflammation has been linked in a number of studies, including in MS, to clinical depression. And if we can reduce the inflammation, we can reduce the depression. Likewise, if we can reduce the depression, we may be able to reduce some of the inflammation in the central nervous system as well. So, first thing I wanted to mention was challenges in the present. Well, one challenge is kind of recognizing symptoms of depression so that you can get them aggressively treated so you can enjoy life again. Another challenge in the present that is kind of common in MS is anxiety, clinically significant anxiety, worrying about the future, worrying about what is going to happen, worrying about how you're going to be able to cope. Excessive worrying is very common in MS. We found in our studies, and others have also corroborated this, that the majority of persons with MS have levels of anxiety that are clinically meaningful or significant. So we want you to kind of, if you're experiencing that, to get treated for that as well, because there are studies that have demonstrated that there are a variety of things that can do to help reduce anxiety as well as depression in MS. And if you think about it, anxiety is always about the future. It's never about the present moment. And what I mean about that is that if you think about when you're anxious or nervous about something, anxiety is the feeling that you feel when you expect something's going to happen in the future and it's going to be bad. So when we're anxious or nervous, we're thinking about tomorrow. We're not thinking about the present moment, the here and now. So one common thing that we've been teaching people on how to cope with and deal with their depression, with their anxiety, is staying more in the present moment, keeping their consciousness focused on the here and now. This is known as mindfulness. And I'm sure if you look at the news or if you kind of read any MS publications, you'll see a lot is being published out there on mindfulness and the management of anxiety in MS. So this is an important tool to help manage anxiety. And again, this can be taught to you. There are a number of books on mindfulness meditation. There are classes on it. It's very popular right now. And again, asking to speak to an MS mental health professional who is knowledgeable about mindfulness and mindfulness meditation will go a long way towards, helping you learn these techniques to allow you to kind of manage your anxiety adequately. So there are certain thought patterns that are associated with both anxiety and depression. With anxiety, it's expectations about the future, and the expectations will be negative. With depression, it's kind of negative expectations about the future, expecting negative outcomes about the future, kind of in a way thinking negatively about yourself, thinking negatively about other people, and thinking negatively about the future. So negative thinking in general is associated with depression, and with anxiety, it's expectations about the future that are negative in nature. So part of cognitive behavioral psychotherapy is getting you to recognize, hey, you're so worried about the future. What about now? That future you're worried about may never come. Live in the present moment more. Or when it comes to depression, we find that in depression, people's negative thoughts are exaggerated in nature. And so getting people to realize, hey, all that negativity you're thinking about yourself and your potential outcomes and the future and your relationships are probably distorted somewhat by the depression. Depression sits on our shoulder and lies to us, tells us that everything is bleak and everything is dark. So kind of managing depression means kind of fighting back against that negativity and getting a more well-rounded perspective on things, thinking about happy memories, thinking about the positives in one life. When you're depressed, it's almost impossible to see any positives, and yet they're there all around us, just kind of waiting for you to find them. So these are some of the changes that can occur with MS, and we know that they're eminently treatable and that there are many things that you can do about it. Recent research has shown even exercise can impact both depression and anxiety. So exercise, is another powerful tool that can be used to directly treat anxiety and depression in MS. And there's a lot of research on this in progress right now, looking at the effects of exercise and how effective is it, and how effective, is it compared to other kinds of treatments for depression and anxiety. So we encourage persons with MS to exercise, but of course, before you exercise, we want to make sure you're going to do it safely. We want to make sure that you're going to exercise in conjunction with your healthcare team's recommendations. For example, some persons with MS are heat sensitive, and if they get their bodies overheated, they can feel weak, or they can kind of feel their MS symptoms more strongly. So if you are a heat-sensitive person, we want to make sure that when you're doing aerobic exercise, that you do not raise your core body temperature, and that you exercise in a way that will keep you cool, either through cooling devices that you would use when you are exercising, such as cooling vests, or swimming, which can kind of give you good aerobic workouts without raising your core body temperature, or many other techniques and approaches that your healthcare team, that a physical therapist, for example, can discuss with you, so that you can exercise safely, and not only for safely with regards to not raising your core body temperature, but safely if you have balance issues or other MS symptoms or spasticity or other symptoms that would, potentially interfere with exercise, or symptoms that you have to know how to cope with in order to exercise safely and yet in a very rewarding way that will achieve the desired results. So, cognitive behavioral psychotherapy, antidepressant medicine or anti-anxiety medicine, and exercise are all things that you can do that can have a major positive impact on anxiety and depression. Now, other challenges that might emerge are changes in sexual function can occur readily in MS. Sexual problems are very common in the general U.S. population. About 40-something% of adult Americans report at least occasional problems with sexual functioning. In MS, that goes up significantly. And that kind of makes sense. I mean, if you think about some of the symptoms of MS, they could include things like decreased sensation throughout your body, including the genitals, or it could include pain. Different kinds of pain syndromes can occur with MS. Fatigue, perhaps the most common, symptom in MS, and fatigue can interfere in the quality of life, and also people generally don't feel so sexy, when they have like severe fatigue that's MS related. So there are many MS symptoms that can interfere in sexual enjoyment, sexual pleasure, and yet we've learned in our studies that we can significantly improve that in people with MS. So in all my years and in all the clinical trials I've done on improving sexual health and enjoyment in persons with MS, there's one thing I've learned that is probably the most important thing towards improving this aspect of your life. And that is, if you can first get some information about sexuality in MS, either through MS organizations such as the National MS Society, the MS Foundation, the Consortium of MS Centers, or other organizations that are dedicated to multiple sclerosis, or so that you can kind of understand a little bit about what can get affected and how it can be treated. So getting information is the first step. And information is very readily available out there, and that's good news. We've also found in a couple of our clinical trials now that just providing persons with MS and their partners with education about sexuality in MS and what to do about it significantly improves sexual functioning. So, in other words, just reading about, what can go wrong and what to do about it can improve sexual functioning significantly. And we've learned that in one randomized clinical trial that we conducted, and in a second randomized clinical trial we recently completed. So, and in addition to that, getting expert consultation from your healthcare team is important. Now, sometimes people with MS tell me that, well, my doctor doesn't ask me about sexuality and I'm kind of a little embarrassed to bring it up. So this is important. As I said in the beginning of my mentioning about sexual health, is that you need to bring it up. You need to be able to talk about it, with your healthcare team. And so if it's difficult for you to talk about, bring your partner with you to a visit. Write it down. Kind of give your healthcare team a note. Say, what about my sex life? And, it's not where I would like it to be. And our surveys of physicians and healthcare team members have indicated that many times they don't ask about it directly because they have a lot of other things on their mind when they're seeing you for an appointment, such as, is your MS stable? Do I need to send you for an MRI? Do I need to change your disease-modifying therapy? So they have a lot to do that's on their minds when they come and visit you, and sometimes they won't mention or ask you about things like depression or anxiety or sexual functioning. So it's important for you to kind of be assertive with your healthcare team and bring these issues up and say that you would like help with them. Because in our studies, we found that if you ask for help with them, they'll provide you with help for them and or give you referrals to people that will be able to help you with these issues. So there is help out there for almost any of the challenges, the symptoms, and the impairments that MS can present. One of the interesting things that we found over time when we look at the quality of life in persons with MS is that the mental health aspects of quality of life tend to improve over time. And this kind of co-occurs as depression tends to lessen over time in MS. So even as the MS might be getting a little bit worse physically, mentally, over time things improve. So there's been something called benefit finding that we've been learning about in MS. And benefit finding is the silver lining, so to speak, to a disaster. For example, one of my patients told me, Dr. Foley, MS saved my marriage. And I asked him, what do you mean by that? And he said, well, I was taking my marriage for granted. And I really wasn't paying much attention to it. And I was focusing excessively on work and other things. And I realized after I got MS and I had to refocus my life and reprioritize my life, how important my critical relationships were, how important my relationship with my wife was, how important my relationships, with my children and my friends were. And so a reprioritization takes place in the face of significant life challenges. And people reprioritize and reorder their lives. And so that's what he meant by he said that MS saved my marriage. That had he not been diagnosed and not gotten that wake-up call, he wouldn't have reprioritized his life and gave his marriage the attention it deserved to preserve it and nurture it moving forward. So this is something that I've learned in working with people with MS and their families, how adaptable they are, how flexible they can be over time. So if you find yourself stuck or in a pit, so to speak, emotionally, because you've just had a major exacerbation and don't know if you'll be able to go back to work, or if you have new symptoms that have developed and you find it disheartening, that is only temporary. That moment. That is a moment of where you will mourn the loss that has occurred to you, because grief is also a part of MS. Grief in the losses that you have experienced, or in the idea or vision that you had kind of for yourself and your life. So there is normal grieving that takes place in MS that is not clinical depression. It's simply acknowledgement and sadness of very real losses that one faces. But the difference between grief and depression is grief is about sadness and acknowledging losses, but one can still enjoy life and still appreciate, one's relationships when one is going through a period of grief. In clinical depression, you can't do that. And so that's important to kind of to notice. But after you acknowledge the losses and you grieve, then there's the period when your adaptability will kick in, your problem solving will kick in, your learning how to cope will kick in. And you'll find yourself being able to move on and problem solve what you're dealing with at the moment. One of my patients with MS told me that, Dr. Foley, every day I wake up and I have to live with this chronic anxiety. It's like the sword of Damocles hanging over my head by a hair every day. I do not know, when my next symptoms will occur. I do not know if I'll have another exacerbation or when it will occur, or what will be taken away from me. And one of the challenges of living with MS is living with uncertainty every day. Now, most of us live with uncertainty. No one has a crystal ball, and no one can predict our individual futures. And I always say to myself, thank goodness I could never see my future. I wouldn't want to be able to have seen the challenges that life has presented with me over the years, and I would rather just take them as they come. But managing the uncertainty in daily life of living with MS is one of the challenges that you face, and that's one of the things to master about living in the present. After a time, people kind of start developing something called MS self-efficacy. And what that means, it's a coping confidence. I've had many people tell me, oh yeah, I kind of managed this exacerbation and that exacerbation. I managed to kind of cope with this and that. And after a while, people will begin to learn that, okay, MS changes may come down the road at me in the future, but I have experience now that I know I can learn to adapt and cope with these things. I have a healthcare team in place. I have a support team in place. I'm going to rally the forces, if something changes in the future, to be able to understand what's happening to me, and so that I can develop a plan to, again, improvise, adapt, accept, and then enjoy life. One thing I haven't spoken about yet are cognitive changes that occur with MS. And many patients, tell me they're kind of very nervous about that or worried about that. They ask me, well, is this like Alzheimer's disease, or am I going to develop a dementia? And we know that cognitive changes in MS are not like the changes that take place in Alzheimer's disease or very, very serious, illnesses that kind of cause a very severe dementia. The vast majority of the time, when cognitive changes occur in MS, they're much more mild than that, and they only occur in certain areas. They don't occur in all aspects of cognition. Cognition is divided into many different cognitive abilities. Our ability to multitask, for example, is our ability, how quickly we can process information, our ability to learn and remember verbal information or visual information, our ability to problem solve and think flexibly, think outside the box. All of these things represent different cognitive functions, and MS can just perhaps hit one of them mildly or two of them mildly. So we know now that it's important to kind of identify when cognitive changes take place so that we can help people deal with it via something called cognitive rehabilitation. Cognitive rehabilitation is kind of like physical therapy for the brain. When you go and get physical therapy for MS, well, the physical therapy isn't going to change the lesion in the spinal cord of the brain that caused the balance problem or the other physical problem, but it will teach you how to cope with that. It will give you techniques for how to improve your balance. It will retrain the brain so that balance isn't as much of an issue for you, or whatever other problems that you're facing. And the same thing is true with cognitive rehabilitation. We've found that it can help improve memory significantly. It's not going to necessarily change the lesion that caused it, but we know that it can improve memory significantly, and studies of functional magnetic resonance imaging of the brain show that cognitive rehabilitation can induce better neural networking, thus improving the overall function of the brain. So if you're having cognitive changes associated with your MS, you might begin to forget things quite a bit. You might not be able to think as quickly. You might not be able to multitask. It's important to tell that to your healthcare provider. You may not recognize it in yourself, but a partner may or a family member may. But since there are things that can be done about it, it's important to get that assessed. Many people think they have cognitive changes and impairments, and in reality they don't. They just have a clinical depression. Because when you're depressed, you can't think clearly, you have attention and concentration impairments, so depression kind of dulls the mind. And we find that when we assess people and say, oh, this person's depressed, we treat the depression, all of a sudden their memory returns and their thinking clears up and their problem solving improves. So that's one of the things we kind of evaluate when we're evaluating for cognitive changes. Is this person significantly depressed or anxious, and what do we need to treat first? So again, just being aware of these things can lead you to kind of have discussions with your family members, have discussion with your healthcare providers, because there are treatments and rehabilitation programs out there for all of these things we've talked about today that can improve these symptoms, improve your functioning, and improve the quality of your life. So focusing on the present, getting back to the topic Casey wanted me to talk on today, means recognizing, and becoming more aware of what symptoms am I having? What do I need to address regarding my MS? What do I need to talk to my healthcare team about? Adapting to the future means getting knowledgeable, becoming an expert on that, learning the necessary knowledge that will enable you, that will empower you, that will give you the techniques and tools you'll need to improvise, adapt, accept, and enjoy. Casey, I think I'm ready to take some questions.
All right. Well, to our listeners, if you have a question for Dr. Foley, as I mentioned at the outset, you'll need to be connected online in order to send your question. So again, you're going to go to readytalk.com and enter the access code 7766805. For those of you who are already online, you can use the chat box in the corner of your conference controls to go ahead and send your question via chat. So again, that is readytalk.com, and the access code is 7766805. All right. If you have a question, please go ahead and send it by chat now. And Dr. Foley, some people seem to be naturally better at adapting than others. If someone wants to learn to gain this skill, if they want to learn to be more adaptable, what's the best place for someone to start?
That's a great question, because flexibility and adaptability is really like a personality trait. Some of us are just born to be more flexible than others. And there are good adaptations in life for situations where we need to be very routinized and rigid, and situations where we need to be kind of more flexible and adaptive. So everybody has a different personality, and those different personalities will be advantageous in MS some of the time and not so advantageous in other times. For example, somebody who is a little more inflexible in their personality, they're frequently very good once they develop a routine, like taking their disease-modifying medicines or exercising regularly or keeping to a routine or self-care. They kind of rigidly will adhere to that, and that's great for them. But if that personality is confronted with a new symptom or something that represents a big change in their lives, sometimes they get much more upset, and it takes them longer to incorporate that into their lives in a way where they can, have their personality manage that as well as they've managed everything else. Other people are very flexible personality-wise and can adapt very readily to new challenges, but they may not be so great at kind of remembering to take their medicine on, when they need to take it or other things. So I think one of the important things is to first learn about yourself. What is your personality like? Are you great at routine? Do you love routine? Do you love doing, the same things? Do you love going to the same place on vacation every year? Do you like your routines? Do you cherish them? Do you dislike change? Change bother you? So if you're at that end of the spectrum, you'll be fine. You'll do great once you can accept that there's a change and get over the initial kind of chaos that will cause in your life, and then learn to kind of incorporate the new knowledge and the new coping techniques that you will need to incorporate into your life, into your routine. Then you'll be fine. On the other hand, if you are less rigid in your kind of personal habits, well, then the challenge for you is, you'll probably adapt and accept more quickly changes that are coming your way. But you won't necessarily stick to a routine of self-care like regular exercise that will be helpful to you. So kind of developing schedules and keeping to them will be the challenge for you. All of these things can be learned first by understanding what your style of personality and dealing with life is like. Are you kind of at the flexible end of the spectrum, or are you at the more routine and inflexible end of the spectrum? So learning what your strengths and your weaknesses are important. If you're at the more flexible but less routinized end of the spectrum, you're going to need reminders to do things, and kind of maybe kind of some kind of prompts and assistance or reminders from others, or kind of developing kind of systems for yourself so that you'll remember to do the things that are representative of good self-care on a daily routine basis. And so, again, these things can be learned very readily by either through counseling, by consultation, with your healthcare team, whether it's your nurse, social worker, physician, and likewise, if you're at the other end of the spectrum, again, knowledge is critical. Knowing, that, okay, I don't like change. I'm not going to adapt very well, but eventually I will. Kind of acknowledging that will allow you to move forward. So know thyself first. Know one's strengths and weaknesses. Learn to use one's strengths to compensate for one's weaknesses, and make use of your healthcare team. Make use of other persons with MS. In that, whether it's in MS forums, through MS organizations, through whether it's support groups or educational and informational groups. There's a lot of resources out there for you to learn how to improvise, adapt, accept, and enjoy.
All right, and our next question is from Rita. She would like to learn more about mindfulness exercises that you mentioned. What exactly are mindfulness exercises, and where can people learn more?
Okay, that's a good question. Mindfulness, in a nutshell, is training yourself to be completely aware in the present moment. Let's do a quick 2-minute mindfulness exercise right now for all the listeners out there. I want you to focus now on your immediate environment. Look around the room that you're in and take in all the visual details of it. Listen. What sounds do you hear? The sound of my voice you hear? Are there other background noises that you hear? Or other voices in the background? Focus on all of your senses. Sight, sound, touch. What's the temperature in the room that you're in? Are you chilly? Are you comfortable? Are you a little on the warm side? Notice the temperature. Notice, are you sitting? Are you lying down? How does your body feel in the posture that you're in? What are your senses telling you? I'd like you all to take a slow, deep breath and inhale. And then slowly let your breath go. And just notice how that feels and how that makes your body feel. So mindfulness is really being acutely and intensely aware of the present moment and everything that your senses are telling you about the present moment. Sight, sound, touch, smell, taste. Be aware of that. When you focus your mind on all of the details of the present moment, there's really no room for worry in it. There's no room for anxiety in it. So you'll find as you practice the skill, and there are many books out there on mindfulness. Dr. Jean Kabat-Zinn from Harvard kind of wrote one of the first major books on it on mindfulness called Wherever You Go, There You Are. And the kind of funny title of it kind of reflects the idea of being completely immersed in the present moment. So you can do mindfulness meditation exercise with anything that you're doing. The next time you have a meal, really focus on the meal itself. How many of you kind of just eat without really focusing on the texture, the colors, the taste of everything that you're eating? So being completely immersed in whatever activity you're in is the essence of mindfulness, and it is a skill that everybody can acquire with practice. So if you just Google mindfulness books, there'll be a lot out there for you. There are classes in mindfulness meditation kind of pretty much throughout the United States. So there's many different ways to learn this. I'm sure you can download mindfulness apps on your smartphone that can help you focus meditatively on the present moment. Yoga is a form of mindfulness because you have to focus so intensely in what you're doing and in the postures and in the breathing that takes place. So there are many different forms of mindfulness. The essence of all of them is to have 100% of your focus in the present moment, all of your senses aware of, and whatever is there, complete acceptance of that. So you're just going to be aware of it and accept that. Those sensations, those sights, those sounds. Even if you find your thoughts flipping back to worrying, just say, oh, there goes those worries in my head again. Now let me refocus, on what I'm doing in the present moment. So mindfulness means two things, awareness and acceptance.
All right. And one final question. You mentioned cognitive rehabilitation.
Yes.
How widely available is cognitive rehabilitation, and is it something that insurance companies are covering?
Okay. we find that with our patients in our clinic, when the neurologist writes a prescription for it and the patient has had a neuropsychological evaluation that documents cognitive impairments, that the majority of the time it is covered by their insurance companies. Now, there's a lot of variation in insurance companies, and you may need to find in-network people to provide that service. But again, you will need two things: a prescription by your neurologist, and most likely, before you can get cognitive rehabilitation, you will need a neuropsychological assessment to document that you have some cognitive changes that can be rehabilitated.
All right. Well, that's all the questions that we have time for. I'd like to remind everyone that if you missed any part of this program, it will be rebroadcast on msfocusradio.org and available on demand later this month. The Multiple Sclerosis Foundation's Facebook, Twitter, and Instagram will have times and access information when it becomes available. I'd like to offer our sincere thanks to our sponsors for support of this program, and to all of our callers for your support and participation, and especially to Dr. Fred Foley. Thank you for a thorough and engaging presentation on this important topic.
You're welcome, Casey. Thank you, and thank everyone out there.
Good night, everyone.